2-deoxyglucose, 2DG, 2DG.org. Cancer needs a lot of glucose, or sugar. Glucose is the main fuel source for cancer. Is it possible to starve cancer without starving ourselves? Can we stop the growth of cancer by disrupting its glucose metabolism? If you do everything right, yes. What distinguishes cancer cells from normal cells? Cancer cells exhibit the Warburg effect. This cancer adaptation phenomenon causes tumors to grow more acidic, speed their biosynthesis, and become resistant to apoptosis, avoiding the body's natural way of eliminating cancer cells. Most importantly, it enables cancer to consume a lot of glucose. 2-deoxyglucose, 2DG, a molecule similar to glucose, is also taken by cancer cells. The Warburg effect allows cancer cells to generate energy through a less efficient but faster process known as aerobic glycolysis. Cancer cells consume around 200 times the amount of glucose that normal cells do. It obtains glucose from our bodies, even when we do not consume any food. This increased consumption of glucose is a characteristic of cancer cells and sets them apart from normal cells, allowing them to rapidly grow and divide. By interfering with cancer cells' energy cycle, we can activate a variety of biological processes that efficiently stop and eradicate cancer cells. 2-deoxyglucose, 2DG, is a glucose analog that starves cancer cells by attacking the glucose metabolism. 2DG can effectively slow down cancer cell growth and development, as well as facilitate cancer cell death. Each type of cancer is different and has its own set of DNA mutations. Therefore, two people with the same cancer may respond differently to the same treatment. However, all cancer types have the same metabolic profile. All malignancies rely heavily on sugar for energy and growth, making it a hallmark of cancer. 2-deoxyglucose, 2DG, a sugar analog, enters every tumor cell and has an impact on every type of cancer. It can be regarded as universal cancer therapy. How is 2DG used to treat cancer? 2DG is a versatile tool that is used in the following situations: as a single treatment, in combination with other conventional or alternative treatments, and for cancer relapse prevention. 2DG can be used as a standalone treatment or in conjunction with other treatments to manage cancer. When taken before or after radiation therapy, chemotherapy, immunotherapy, or targeted therapy, it improves the effectiveness of those treatments. Furthermore, it is also useful in preventing cancer from returning after the initial treatment has been successful. When and how should 2DG be given? The powdered form of 2DG is dissolved in room temperature water and consumed on an empty stomach twice daily. Patients should fast overnight before the morning dose and at least 3 hours before the evening dose. During the fasting period, drinking water is allowed. Regardless of body weight, a single dose of 2DG powder should never exceed 2,500 milligrams. People around the world report excellent tolerability with 2DG treatment, which is very encouraging. While 2DG is generally safe, you should learn about precautions and possible risks before beginning treatment. Even though 2DG works on its own, you'll get the best results if you combine it with other therapies and figure out which approach suits you best. It can take at least 2 to 4 months before you can see results. Tumor size reduction on imaging studies, a drop in tumor markers, or improvement in your overall well-being. To find out more about 2DG, please visit www.2dg.org.